Public health data collection has been halted in several key areas as Health and Human Services Secretary Robert F. Kennedy Jr. slashes funding across HHS agencies and departments. The funding cuts have impacted programs that track national statistics on HIV, STDs and STIs, abortion, sexual violence, cancer among firefighters, and postpartum risks. Officials who have been put on leave from these departments say going forward, data on these topics likely won't be collected or made public the way they were before. CBS News medical contributor Dr. Céline Gounder joins us now. She's the editor-at-large for public health at KFF Health News. So, Doctor, what are the consequences of cutting back on this data collection?
Yeah, what we are witnessing is mass dismantling of CDC and other public health data surveillance systems, really applying to anything that touches on health in this country. It's a little bit like if you think about police departments trying to fight crime. If they don't know when and where it's happening, how it's happening, to whom it's happening, who's committing the crime, they can't fight crime. They can't be going door to door at all hours of the day, right? Like that is the kind of data you need to target your resources so that you are not wasting funding, so that you are using your limited resources as well as possible. And I think it's fair to say that some of these cuts, quite frankly, are reckless.
In 2019, President Trump vowed to defeat AIDS in America and beyond, but the CDC branch that focuses on HIV surveillance was eliminated as a part of these cuts. So what kind of threat does that pose?
Well, there are a number of different things that they were doing to try to reduce the rates of transmission of HIV in this country, to eliminate it so that it would no longer be a threat in this country. So, for example, there is an outbreak of HIV in Maine right now, where staff from the CDC would normally be trying to figure out, again, how it was being transmitted, where, among which people, what could they do to prevent and reduce that risk. There are medications called pre-exposure prophylaxis, which is a little bit like taking birth control, but it prevents you from getting HIV in that case. And how could we target that better to people who are at risk? We know that there are certain PrEP.
Okay.
Exactly. And so we know women who are high risk, people of color who are high risk, are much less likely to be on those medications than white gay men. And so that's a major gap that they were trying to address. Another is just getting people who have HIV on medications. We call it U equals U, which is undetectable equals untransmittable. So in other words, treatment is prevention. You're stopping the spread by treating people who have HIV.
Let's talk measles. 541 cases confirmed in Texas alone. We know 2 children have died already from the disease there. There have been more than 700 confirmed measles cases in the country. But officials warn that lack of funding for vaccine programs has also helped fuel the spread. So could further cuts exacerbate this?
Well, this is an area that's been underfunded. Public health departments at state and local levels have been underfunded really for years. And what we saw was at least some funding coming in during the COVID pandemic. CDC had allowed state and local health departments to use that, you could say, to mend a very threadbare blanket. And those funds are being taken away now in the midst of another crisis. So some $2 billion of CDC funding for vaccination across the country are being pulled back. And that's literally the resources that they need to be fighting this outbreak of measles.
Can you be a little bit more specific? I mean, that sounds like a lot of money. What does that money do?
Well, so, for example, let's take Lubbock, Texas, which is the epicenter of these outbreaks in West Texas. They get $250,000 per year from the state in order to combat these infectious diseases, to vaccinate. Now, think about how many people are in your doctor's office. How many people can you employ with $250,000? Not just the people, but the supplies, transportation. You know, you're in an area where there's a lot of rural households, farmland, gas and oil and gas. And so you need to have clinics open in the evening, on the weekend. So $250,000 for a city the size of Lubbock, Texas is not a lot of money.
Yeah. All right. Dr. Céline Gounder, thank you.